Hello and welcome to this episode of Focus In. Today we're going to be talking about the understanding of a CVI diagnosis, and I have Jonathan with me. Hi Jonathan, how are you doing?
Hi Cameron, I'm doing well.
Thank you very much for joining us. I know you have a lot of knowledge on this subject, so we're excited to delve a little bit deeper and find out a bit more, if that's all right.
It's all right with me.
So to start off, can you explain what CVI is, first of all, and how it affects vision?
I can try to explain it. It's quite complicated.
I can imagine.
I'll start with what the abbreviation stands for. So
Yep.
CVI stands for Cerebral Vision Impairment,
Okay.
which basically means that someone has a vision impairment that's caused by brain differences or a brain injury
Okay.
rather than something that's happened to the eye.
Right.
Does that make sense?
Yeah, absolutely. So it's not just the eye specifically, it can be. Okay, interesting. And how common is CVI among children?
So CVI is very common among children who have vision impairment.
Okay.
So if we look at the whole group of children and young people
Yep.
who have vision impairment, it's probably something like 30%, 50%
Right.
of those children and young people will have a brain-based vision impairment. But I should probably also say that cerebral vision impairment is kind of it's an umbrella diagnosis.
Okay,
So
yeah.
it covers quite a few different ways in which people will see the world. It's also worth pointing out, so there was a study recently that came out from one of my colleagues in Bristol who believes that there's as many as one child in every primary school classroom in the UK that has some kind of cerebral vision impairment.
Wow.
Maybe that impairment is not so severe that
Okay.
they would
Yeah,
be
yeah.
registered as sight impaired, but it's some kind of CVI that affects the way that they see the world.
So it's a lot, basically, isn't it?
It's
And more
a
than
lot.
people would realise as well. Yeah, and that's obviously varying as well, like you say. So some people maybe not so much as others, but is that a lot of people that aren't aware as well?
Yeah, so so there was another study
Yeah.
in the United States not so long ago that basically they believe that there's maybe 20%, only 20% of the whole population of people that have cerebral vision impairment
Wow.
are actually diagnosed. So they think that there's definitely an underdiagnosis problem. I think that's mostly because it's quite hard to spot. And like I say, there's a wide range of ways in which people behave when they have CVI that can be quite difficult to pick up on.
Yeah, I think that's a lot of the time you don't realise that as well, that actually how many people probably are out there that have that and they're not aware of it as well. And actually that's down to awareness a little bit as well. I know you've explained a few reasons why there, but people not understanding what to look out for as well.
Yeah, it's a relatively modern phenomenon,
Okay.
I'd say. So it's really something that we've only started seeing since like the 1960s onwards. It's not something that everyone has training in. Even vision specialists in the UK don't necessarily fully understand exactly what cerebral vision impairment is because they've been trained in how to understand vision impairment from the point of view of the eye,
Yeah.
and from the point of view of the brain and the visual processing centers in the brain.
Okay. And what kind of age do you think normally you might start, parents, carers, they might start to notice something slightly different and might start to see CVI?
Yeah, so that would depend on the kind of CVI that they have.
Again, yeah.
So you can have CVI from birth. It can be associated with conditions like cerebral palsy, for example. But you can also acquire a CVI after a brain injury. So if we are looking at just the people that are potentially born with CVI, again, depending on the severity, you might start to see differences in terms of not recognizing the parent's face as they kind of come in close.
Okay.
Or you don't necessarily recognize the smile or changes in facial features. But it really depends on the kind of CVI that the person has. It can be, if it's very severe, it can even be so severe that it's as if they're cortically blind, so they can't see the world at all.
Right.
But then there are other young people who might, for example, just struggle with something like being able to recognize a person's face.
Okay. Yeah.
And in which case they might be able to navigate, find themselves around an environment really easily. But just struggle with kind of one or two issues. So I think it really depends on the kind of vision impairment they have. That's where we struggle to make sure that we find everyone who has this kind of condition.
Yeah.
In fact, it's only very recently that we've even come up with a diagnostic kind of criteria for it. So
yeah, and I suppose that's why it makes it so complex as well. If there's such a wide umbrella, like you say, of different types, and it's harder to notice. Sometimes it's easier, and that just makes it harder for professionals, parents, carers to just recognize what to be looking out for as well, I guess.
Yeah, but there are some common themes. So there are certain kinds of subgroups, you might say, of people that fall into the category of CVI, and they might, there's some like characteristics that you might see, for example, bumping into things because you don't see them, like I say, not recognizing a face in a crowd. One of the probably the most common characteristics that we see with young people who have CVI is they struggle with lots and lots of sensory information. So if they're in an environment where there's a lot of visual clutter or other sounds or movement, they'll struggle to be able to process the things that they can see because there's so much other information that they need to filter out. It's kind of like a processing issue in a way.
Yeah, so if you've got a lot going on, sometimes it's a bit overwhelming, I guess, as well.
Yeah, it can be. So definitely there are times where if there's lots and lots of sensory information you're trying to process, we always use the example of a supermarket because it's so busy in there. You've got sights, sounds, smells, all kinds of things going on. And the idea of having to kind of find your way around in a supermarket can be quite overwhelming, can generate quite a lot of anxiety or some kind of emotional response. Yeah.
Okay. And are there any particular medical conditions or disabilities that might make it more likely, CVI more likely?
Yes. So cerebral palsy is probably one of the most common conditions associated with CVI. There's a number of seizure disorders as well, like epilepsy, that's associated with CVI. Brain injury, so like traumatic head injuries, are associated with CVI. And there are even kind of developmental conditions which can be associated with CVI. And probably the two most common one would be autism and one would be what's called developmental coordination disorder. And there are similar behaviors that you see in people with autism and DCD and CVI. They look very similar, but they have very different kind of underlying causes for why people behave the way they do. And again, that's one of the other reasons why it's quite difficult to work out exactly how many people actually do have CVI or don't.
Yeah, and you've covered a few, but also early signs. There's sort of something early on that you can help notice, perhaps could be CVI.
Let me think. So I would say definitely clumsiness is one of those.
Yeah, that's definitely a pattern
quite often.
Yeah.
So bumping into things, tripping over things, and that comes from potentially not being able to see into what's called your lower visual field. So that's quite common, particularly with those that have cerebral palsy as well, just because of where certain brain structures are.
Yeah.
They're quite close to each other. So where the lower visual field is processed in the brain is very close to areas that are involved in processing movement, for example. Not being able to recognize people is another.
Yeah.
So this idea that it can be quite hard to recognize the difference between different people's faces.
Okay, yeah, so you're kind of almost seeing a few different people as it sort of looks quite similar and hard to differentiate between a few different people potentially.
Yeah. Being in new environments, like somewhere completely new where they haven't been before, can be quite confusing. So it's difficult for them to understand what exactly it is that they're looking at in those environments.
Okay, yeah.
So novelty is kind of an issue. Some young people have difficulty with what's called visually guided reach. So that's the map of their body in space doesn't quite match the map of where they see things in space.
All right, okay.
So they might be able to see an object that's right in front of them, but if they go to reach for that object, so say it's like a cup, for example, to pick up, they might look away from that object while they're going to pick it up, so that there isn't this kind of confusion between what it is that they're looking at and where their hand is in space.
That's interesting, yeah. There's a lot of different things, isn't there?
Yeah. Visual clutter is definitely the big one. I think too much visual information is quite often
like overloading always. Yeah. And I think what's tricky sometimes with things like this is just knowing what to do. So if you suspect, I think, my child, or I think a young person that I know may have CVI, it's sometimes such a minefield, isn't it? What do I do? What are the next steps? And if you've got any advice on that, of like, if someone maybe suspects that, or they're seeing some of the things that you mentioned today, what do they do next? What's the next step?
Yeah, so that can be quite tricky, actually, and finding the right people that know exactly what to do in that situation in terms of like healthcare professionals. So if you are already seeing a specialist for one of these kind of other conditions like cerebral palsy, there's a good chance that you'll be talking to what's called like a neurodisability service within the hospital already. So those are kind of the people that you want to get to meet. If you're not already in that environment, if you're not already in that system, and you think that you're seeing behaviors that could relate to CVI, there are a couple of different people that you could speak to. One is your local advisory service. They tend to get involved when a young person is sort of, 4 or 5 years old, so not necessarily earlier than that. And they will hopefully find like a qualified teacher of the vision impaired to work with that young person. Sometimes you need a diagnosis, and this varies from local authority to local authority, but sometimes you might need a diagnosis, and to get a diagnosis can be quite tricky as well, actually. So the best person to speak to is usually your GP to see whether or not you can get a referral to a ophthalmologist. There are lots of different terms for the kind of medical professionals that work with people who have vision impairments. You have ophthalmologists, orthoptists, and optometrists. But the ophthalmologist is the one that you want to go and speak to. They will rule out any potential causes of visual difficulties that might be the result of something going on in the eye. And they're typically a pediatric ophthalmologist will be the person who will give you a diagnosis, and that will hopefully help you access other services.
Yeah, and that's the diagnosis. And what is that process as well for anyone that's thinking that sounds quite scary? Diagnostic process and lots of big names of people that you need to speak to. But what can you expect as the process to be, basically?
So it's usually a case of history taking.
Okay. Yeah.
So the ophthalmologist will ask you a number of questions related to what happened to this child or young person, either when they were born, before they were born, or after they were born, to try and find out whether or not there's any indication that there potentially was a brain injury or a brain difference.
Right.
So that's the first thing we have to know is like, has something happened, something occurred that would indicate that this person has a brain injury or a brain difference? The other thing that you have to do is rule out the possibility of there being differences in the eye. And that involves having what's called like a slit lamp kind of test, where they will shine a light directly into your eye and have a look to see if there's anything going on at the back of the eye, to rule out any potential kind of eye-based problems.
And then going forward from there, obviously then can decide whether it might be something that's CVI rather than from the eye, basically. I'm getting the hang of it. I'm getting there. Yeah, I can make sense. And how long do you think it can take as well? I mean, it must vary, because that's a tricky question, isn't it? How long does a diagnosis take? Which can feel like a bit of a how long is a piece of string question. But is there kind of like a sort of standard process of how long you'd expect?
So again, the problem is that, well, there's a couple of problems. One is that we've only recently decided on a diagnostic criteria. So not every ophthalmologist uses the same kind of sets of tests and assessments.
It's different
in order to work out exactly whether or not someone has a cerebral vision impairment. So I would say it would depend on the severity of the vision impairment itself.
Okay.
And the complexity of all of the other potential conditions that person might have. Because it can be very difficult to ask someone to do, for example, one of these slit lamp type tests.
Yeah, of course. Yeah.
And it takes a long time to get referred to an ophthalmologist, because there aren't very many ophthalmologists in the UK, and there aren't very many that are that have the specialist knowledge that's required to do the kind of diagnosis, the assessments that are required to give someone a diagnosis of CVI. it really does vary. So I'd say it could take 3 months, it could take several years.
It's hard to know, isn't it?
It really is.
There's
Yeah,
so many different
unfortunately,
elements
there's
to it.
just, yeah.
No, I get that. And I think also what people find quite daunting with something like this or diagnosis is, what are the next steps? You know, what happens next? Because that's the scary part of the diagnosis, which can seem a little bit unknown. But then the next part is like, okay, right, I've had that diagnosis, but what can I expect next? You know, what will happen for the young person or myself if it's someone that's themselves, you know, so what can they expect afterwards?
In terms of support services?
Yeah, like and maybe, you know, what support they can get and what it might look like for them going forward, basically, once they've had that diagnosis.
So once you've had a diagnosis of CVI, there's a couple of things to bear in mind. One is that someone who has cerebral vision impairment, their vision can change over time. And one thing that we have noticed is that it tends to improve over time, actually. Okay. So there's not in all cases, so we have to be really careful about measuring expectations.
Yeah.
But there is the possibility of there being improvements in functional vision over time. So long as we can make the environment accessible to that young person, which really means kind of stripping back the visual clutter that I've spoken about previously, then there are a number of different services that you might want to get in touch with. So as I've mentioned, there's the local advisory services, sensory advisory services. We have qualified teachers of the vision impaired who can help you understand how to change your environment to make it as accessible as possible. You might also be able to get access to an occupational therapist or an early years practitioner who can help you to do kind of activities during the day to help almost kind of stimulate visual attention in order to try and get someone to like activate their vision and then start to use that vision to help you do daily activities.
Yeah, and that's quite practical, isn't it, I think, in terms of what support is, but as well, emotionally for someone it is a lot as well, isn't it? Because I think sometimes you can just think about, okay, right, practically I need to get a diagnosis, what's next, what support can I have? But actually, emotionally, there's a lot to deal with as well. So what, you know, is there support for that? What can they expect as well?
Yeah, so in the UK, like there's a couple of good groups that you can get in contact with. So there's the CVI Society. And in Scotland, there's a really great group, a charity called CVI Scotland. Those charities both work to help parents and families understand more about the condition, and to advocate for the children and young people and their families when it comes to talking to their schools, for example, to get changes. So I think those two organizations, they're like good advocacy groups, and there are often other kind of like parent advocacy groups within regions, within localities that people can then go to get into contact with.
Conversation. And I think it's important as well that you've mentioned is the help for the families as well, because sometimes it can all be focused on what support is there for that young person or whoever that is that has had that diagnosis, but actually the families need the support as well, because it's quite a grey area, isn't it? Okay, right, I've had a CVI diagnosis, or my child has that. What does that mean? You know, and
I mean that's a really good question actually, because I think it's very hard to describe exactly what CVI looks like to someone. And even to the young person themselves, because quite often if they have been born with CVI, they only know the world the way that they've seen it, so they don't know that it looks any different to them
of course,
as it does to other people. And then trying to explain exactly what that picture of the world might look like to parents can be quite complicated as well. So finding ways in which you can draw that out, explain exactly what the child's perception of the world is quite complex, but it's really, really important to try and get the parents to understand, okay, what does this actually look like for my child, and what can I do to help support my child?
Yeah, and to have that empathy as well. I mean, I spoke to Nick for In Focus before, and she said how actually a big thing for her, and it's really important, is to have that empathy, because you so just have, even if it's a small understanding, just what that young person is going through and how, like you've just said, what it looks like for them, which is different to what we might expect, and how the day-to-day goes, you know? Yeah, so it's important to know. And how can people support with the day-to-day? Because I think we've talked about overall, the diagnosis and the big overall support, but actually it's quite important to think about just the day-to-day of living with CVI as well.
From the point of view of the child or the young person?
Yeah, I think there's both sides to that as well, isn't there? But initially for the young person, how can you support them just with their day-to-day activity? And maybe that's through attending school or a specialist college or whatever stage they're at. How can that be supported?
Yeah, so I think there's lots of different ways in which you can support someone who has CVI. The first thing you need to do is try to get to the root cause of what their visual difficulties are. Like I say, there's a number of different issues that someone could have, different ways in which they see the world. So I think that's where you need to start. So exactly. So you need to get really down to the root cause of what the issue is.
Okay, yeah.
To try and work out, okay, where exactly is the difficulty here? Once you've worked out what the difficulty is, then you can work towards removing that difficulty from the environment. I think mostly, well, let's put this another way. So at In Focus, we use a particular framework called the CVI range framework, which works through kind of 3 different phases of visual development. So someone might start in the very first phase of visual development where they appear to have almost no vision at all, no functional vision.
Yeah.
They're not really attending to things in the environment. And in with someone who has functional vision in this first early phase of visual development, we might work with them in kind of out of classroom environments that are very controlled.
Yeah.
Where all of the visual information has been stripped from the walls. There's like no posters. I've heard in other schools and colleges they use kind of coloured tents.
Okay.
So like a plain coloured tent, and just to remove all of the unnecessary information in the environment, and then work to kind of stimulate the attentional networks in the brain by moving a single kind of object around to see whether or not they can develop the ability to track that object.
Yeah.
But then after some time, you would hopefully see that they're able to start to activate their attention in these very controlled environments and move towards what we'd call a phase 2 environment, which would be something more like in the classroom, in the college, where we've maybe removed all those posters from just 2 walls, or we've given them some kind of occluder so we can like avoid all the distracting movement in the background when we want them to focus on the work in front of them. So those are a couple of examples, but there are so many things that we can do. It's almost
and again unique, I assume, to the person, the young person.
I think that's the main
them.
That is the main thing. So is because there is such a wide range, or let's say a spectrum of difficulties and challenges that a young person with CVI has, all the kind of environmental adaptations or interventions that you would use are unique to that individual. They have to be. It's really about getting to the root cause of the problem. Where is the visual difficulty? Do they have trouble seeing moving objects, or actually does movement help them see things? Do they have issues with certain kind of colors? Do they have difficulty processing certain types of objects? There's a whole range of different difficulties that they could have, and you have to work out which of those different difficulties they have, or which are combined, and from there build a set of interventions and adaptations that can help support them, importantly, to access the environment or their learning as easily as possible. And then once they're accessing things visually, it becomes possible for them to develop their functional vision over time. But we need to make the environment accessible first before that can happen.
Yeah, absolutely. And that, I would say, that's in quite an education style setting, wouldn't it be, like a college and school? And is there anything particularly, maybe just personal life, maybe if it's home life, residentially, that can be done as well? Because it's harder to do things such as that, isn't it, in that environment, because we don't have a situation where we can take everything off the walls, or we can have a tent or something like that. So is there something in a day-to-day home life that can be supported?
Yeah, I think it's about being predictable and having a kind of structure to your day. I think that can really help. There are kind of small visual adaptations you might make at home. I mean, maybe you don't want to take all the family photos off the wall, but you can make sure that things are cleared away and stored appropriately in between activities. And you can take time to do things which are visual and things which aren't. So we don't expect everyone who has CVI to constantly access the world through their vision. They have all these other senses that they can use as well, and sometimes it's nice to take a break, listen to some music, and almost kind of switch off your vision for a bit.
Yeah, I think there's a learning curve for everybody as well. And if it's a family, for example, you probably learn quite a lot from that situation as well. I think you'd be quite surprised, really, wouldn't you? And then hopefully it can help you empathize a little bit more, like we were talking about earlier, with that person with the CVI diagnosis, a little bit more, help to understand. Yeah. And to finish, let's look forwards and just think about what the future might look like for CVI, because you've explained and I've learned that it's quite new. And so there's a lot to learn. But what do you think the future looks like?
I think it looks good. And that's the positive that I want to take away. And at the moment, we have a better understanding of what's actually going on in the brain.
Yep.
And we have a better kind of system for communicating between all the different professionals that tend to be involved in understanding what CVI is. So, teachers, medical professionals, academics, they're all communicating with each other now in a way that I don't think was really happening even 10 years ago. So I think people are collaborating in a way which I think is more effective now. And I think we have a better understanding of exactly what we mean when we say CVI, what that does cover and what it doesn't cover. There's still more to be done in terms of making sure that we raise awareness of how common this condition is, because I really don't think people understand how common it is.
No, but that's what surprised me. Today. Yeah.
And I think we're getting to the point where we're starting to develop kind of evidence-based approaches to teaching, to occupational therapy, to physiotherapy. There's a range of different evidence-based approaches that are in development that could potentially improve functional vision or potentially improve mental health and well-being, as you've spoken about, for these young people. So developing self-advocacy programs is really important as well.
Yeah.
So I think the future looks positive.
It sounds good. Yeah. And it's learning, isn't it? There's a lot to be learned, but it is being learned, and people are starting to work together to understand it a little bit more. And more awareness, I think, because things like this and talking to people like yourself, I mean, before I've had no knowledge of it at all. So just people having a little bit more understanding, I think, makes a difference sometimes.
Yeah, hopefully.
Yeah, fingers crossed, definitely. Well, thank you for coming on, talking about, I think I definitely have a much better understanding of a CVI diagnosis now, and hopefully people that are listening have the same. So I appreciate your time, and thank you very much, Jonathan. Thank you.
Thank you.